Welcome to episode 230, Healing Across Generations, Culturally Attuned Care for AA and NHPI Communities, featuring Dr. Anjuli Amin. Make sure to subscribe to be alerted about future episodes by Clearly Clinical. Learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am really looking forward to this conversation today, discussing trauma in the Asian American and Native Hawaiian and Pacific Islander community. I am grateful to Dr. Anjuli Amin today for sharing her wisdom with us. Thank you so much for joining us, Doctor. I'm grateful to have you.
Yeah, well, I am really grateful to be here with you. I'm honored to be able to have this conversation.
So for our listeners who are not familiar with Dr. Amin, she is a active member of the Asian American Psychological Association, and she's been working in the field in a number of states for many years. And one of her specializations in particular is working with the AA and NHPI communities. And I'm looking forward just to having her and having this conversation. So why don't you tell us a little bit more about yourself, Doctor, before we dive into this conversation?
Absolutely. I always hate talking about myself, so I'll do my best to give you as much information as possible. But I am a second generation South Asian, Indian, also in my family's interesting immigration pattern history. There's a little bit of East African origin in my family and British. There's some British history there as well. Thank you, colonialism. So I identify as sort of coming from all those different backgrounds. My parents immigrated to the States from the UK in the early 80s, which is why I identify as second generation here. I am an aunt. I am a sister. I'm a daughter. And all of those identities play a really big role in my life and have been incredibly influential in my work professionally. So I like to just put those things out there. I do come from a number of privileged spaces, just thinking in terms of my proximity to whiteness, with my Asian identity, socioeconomically. My parents struggled a little bit financially, but for the most part, we were okay. Educationally as well, I have my doctorate in counseling psychology. And so those are things that also I like to acknowledge and put out there as things that frame my perspective and that have shaped my life experiences and that pull me apart from others. I have a background in health psychology, but my work has really brought me more towards helping individuals cope with trauma. And I have dealt a lot with military-based trauma, but as we all know, our military population is incredibly diverse. And so I've been exposed to helping folks deal with trauma from all angles. I have a private practice as well that I really enjoy stepping into. And I work with clients based in California, Illinois, Texas. I like my private practice because I think it gives me a really unique way of connecting with my community, which I've enjoyed and have learned a lot from. And you mentioned my involvement with the Asian American Psychological Association. So that was an organization that I joined in 2006 with the encouragement of a professor I was working with my first year in graduate school. And that has become my professional family and home. It's a space where I've learned not only about myself as an Asian American, but have been exposed to and met an incredible number of people who have influenced my perspective and worldviews on just what the Asian American experience is. It's a place where I've had the opportunity to grow as a leader, and I recently completed my term as their president. I'm completing it officially in my last year, helping them as past president. So that's been a real honor for me in my professional career. And it's taught me a lot about administration, organization, leadership. It's brought a lot of challenges my way, but all really great points from which I feel like I've grown and just connected with that community in a lot of other ways. So that's a little bit about me.
Wonderful. Well, thank you again for coming on. Before we really dive into it, I want to comment. As I said before we started recording, there's only so much that could be covered in an hour. And I feel like anytime we're talking about anything relating to any type of culture, it's always scratching the surface. It's speaking in generalizations. And so I just want to acknowledge that out of the gate, when you consider how enormously varied the Asian American population is, and how different these cultures are, really, and they get lumped together. And I think that nuance is important to keep in mind as I have this conversation today. For this conversation, really wanting to focus in on trauma within the Asian American and NHPI communities. Why don't we first just talk about, number one, these terms? So, there are many terms that are used, whether it's AAPI, AA, NHPI. Will you unpack those just a little bit, and then we'll kind of talk about some of the pieces that I think many clinicians in the United States really probably don't know about the immigration story, I think, for a lot of Asian American clients, and we'll go from there.
Yeah, absolutely. So there are many different ways that I think people refer to people who identify as Asian in some way, shape, or form, right? There's Asian American, which is a very generalized term. There's AAPI, Asian American Pacific Islander. There's Asian American and Native Hawaiian Pacific Islander. A lot of these terms have sort of developed out of response to the generalization that occurs when we talk about this group, right? This incredibly diverse group. So many of the variations that we see in terms of, AAPI, AANHPI, AAPIDA, Asian American Pacific Islander Desi Americans, is really effort to illustrate the diversity within the group and the kind of masking that occurs when we apply a generalized term. So, one of my mentors, Dr. Kevin Nadal, talks a lot about how we are not a monolith, right? And within this group specifically, we see, over 50 ethnicities. We have hundreds of religions and spiritual practices. We span multiple generations in the US, going all the way back to even before the United States was the United States. There are just an innumerable amount of immigration journeys and pathways that our families and communities have taken. We have all experienced, I shouldn't say all, but many of our communities have experienced colonialization in different ways. There's diversity across social class and education, gender identity, sexual orientations, and then we've all also had our own unique experience with racism and phenotype as well. So it's just, at this point, we really shouldn't be generalizing in this way, because what happens is then we mask people's experiences. We mask, differences that are actually very important to acknowledge and recognize. And we sort of assume then that we're all sort of the same, which is absolutely not true.
Diving into the intersectionality here, as you said, so many different religions, cultural backgrounds, belief systems, and then it kind of all just gets rolled into one. That complexity with all cultures of kind of putting anybody in a box. Thinking about that piece of intersectionality, one of the things I think that has come along with Asian American identity is this idea of the model minority. For people who are not familiar with what that means, can you speak a little bit about that and how that kind of shows up?
Yeah, absolutely. So the model minority, this concept dates back to World War II, where the term model minority was first used to describe successful Japanese American families in the United States. And that term sort of took off and really supported this false assumption that Asian Americans were more successful than other minority groups. Now, the term can be used as a way to pit Asian Americans against other minority groups and create and sort of maintain division between groups. We're often portrayed as the group that's the most well-educated, financially successful. We're highly career-driven and law-abiding. And while that may be true in some aspects of our communities, it's really not true overall. And again, the perception is really harmful to our communities because of what it does mask. So speaking of mental health concerns, right, it assumes then that this is a group that doesn't really have any mental health problems, right? How could they? They're so successful. They have high educational attainment. They're financially secure. They don't make any trouble. They don't cause any fuss or make any noise, right? And it's troubling because when we look at the stats, we actually see that things like suicide are actually leading causes of concern for Asian Americans. For Asian Americans aged 18 to 25, and then for Native Hawaiian Pacific Islanders aged 15 to 24, suicide is a leading cause of death. So that sort of indicates that, hey, wait a second, not everything is, great here. And it also hides many of the variations that we actually have with respect to financial and social disparities. And that is particularly true for our Native Hawaiian Pacific Islander communities, who are often sort of lumped into this category of Asian American. And that, to an incredible level, really masks their very unique experiences in comparison to some of our other subgroups. When we internalize something like the model minority myth at an individual level, it really can put the pressure on to assume this impossible task of being a so-called model citizen, which studies have shown us can actually lead to increased levels of anxiety and depression.
Thank you. I appreciate you addressing that piece of it and lending a bit more background. You had mentioned the importance of really acknowledging the differences within the NHPI community. Can you speak a little bit more about that? I mean, again, like these are generalizations, but as we're looking at this through a lens of colonization, of how these different places have been affected over time, in your mind, what separates out the Native Hawaiian and Pacific Islander community from the rest of that Asian American lump?
Yeah, I think there's a lot that separates us. There is some overlap, maybe a little bit, just in terms of when we think about migration patterns to places in the Pacific, such as Hawaii, right? But there's a very distinct kind of history there. So many of the communities that originate from the islands in the Pacific have their very own sort of separate history of colonization. They have their own cultures and practices. They have their own ways of being that are different from Asian Americans. They also have just a different experience in terms of what it might mean to be American and a citizen of the United States. So we can kind of think about this as, for a big piece of that kind of migration, modern sort of migration period, sort of, I believe, like after the mid 1960s, we sort of opened up and allowed more folks from Asia to come into the States. That group of people just comes from a very different background, history, space than our Native Hawaiian Pacific Islander populations, who have been really a part of these lands for much longer. And so that alone really, I think, contributes to just a very different experience. And I think the hard part in the unfortunate piece, and, we as a group, I'm going to generalize here, but we as Asian Americans are also guilty of doing this too, right? We can easily kind of generalize and not acknowledge the differences within our own communities, right? And so I just want to say that this is kind of a very common standard practice, something that we're definitely moving away from, but we have to very much acknowledge and recognize before we can start to make those steps, right? But again, just even thinking about history and what it means to be a part of the United States and not a part of the United States, and how we came to be citizens of the United States, right? That alone, I think, separates a lot of what we consider NHPI communities and sort of East Asian, South Asian communities, in terms of our experience here in the States. But again, there's a lot, just a lot of variation, culturally, religion, food, right? All the things that kind of contribute to our life experiences that shape us, that make us who we are. You'll see quite a bit of variation. And for many years, right, and even it continues even today, right, we've sort of just assumed that we all fall under this same umbrella, right, without any of that variation.
Can you speak a little bit about collectivism and the potential different cultural values coming from Western culture, where we just unbelievably value our individuality, and it's a totally different way of looking at and operating in the world. And then also the complexity of mixed race identity for someone who is coming from a cultural model, in terms of their ancestry, that has a much different approach to how we live, how we work, who we spend time with.
Yeah, absolutely. So collectivism is commonly identified as one of those more universal Asian values, right? So over time and through research, we've identified values that are commonly seen across different AA and NHPI communities. A lot of these sort of stem, if you kind of trace that, you could trace them all the way back to Confucianism, and some of our Eastern religions. But collectivism is one that we see quite a bit. And with collectivism, what this means is we prioritize the group over the individual. And that stands in very significant contrast, as you mentioned, to sort of these Western ideals that we have of individualism, right? Where we're encouraged to embrace our individuality. We set out on our own, right, at the age of 18. We're independent, and many things sort of reinforce like being independent. Collectivism, I think, is a value within Asian communities that really sort of enhances and cements our connections to our immediate family, our extended family, even just our kind of immediate community, wherever that might be, right? When I think about like immediate community, I think about my parents and their family friends who also identified as Indian or South Asian, and kind of the aunties and uncles, who we spent time with throughout my childhood, who my parents remain friends with to this day. So this can be very influential in terms of how we might view the world, how we might experience the things that we might do. I'll speak from my own personal experience of, kind of always having this sense of concern, right? How will this look in the community? How will this reflect on my family, right? The things that I do, what I major in, right? My academic or professional career, so on and so forth. But also in the sense of feeling obligation, right? Prioritizing others over myself at times. So there may be something that I would really like to do, but if my parents are saying, hey, we want to do this, I might say, okay, it's fine. I'll, for the sake of kind of keeping peace in the group. So then I might, let go of what I want to do in order to kind of prioritize my parents or my family, right? And so in that way, collectivism can really shape the decisions we make, the things we decide to do. A very good friend of mine told me that every value has a light side and a dark side. She's very much into Star Wars. So she said, it's like the Force. And I said, great, I'll take your word for it. Collectivism is the same, right? So there are a lot of really great things that I think we can benefit from in taking a collectivistic approach. And then there are some things that can make it challenging for us, right? So if we continue to prioritize others over ourselves, right? At some point, we're going to feel that, and that's going to be impactful on our well-being. And this is where I think it can be challenging for those of us who grow up kind of between two cultures. And so you mentioned folks who identify as mixed race, right? And I can imagine that even more so for them, right? Their identity is really inherently tied into two maybe different cultures or spaces. And so there may be kind of uncertainty about what are the values that I hold on to for me? What do I let go of? What works? What doesn't work? Maybe feeling pressure to conform to one versus another. And so it becomes just a really interesting sort of negotiation of identity throughout the course of our life, right? I think about my niece and nephew, who I'm very close with, who are also mixed race. And it's been interesting to sort of watch their identities develop and sort of see how they come into themselves, you know, considering sort of their family relationships on my side of the family and then their family relationships on my brother-in-law's side of the family. And then also kind of the influence that they get just from their world, their school, their peers, what they encounter in the media and in culture, right? And so this is a process that can be incredibly challenging, can be hard to work through. We may feel, like I said, pressure to conform to one side or another. We may not know which values work for us or don't. There may be guilt in letting go of certain things, right, as we get older. And so it's just hard. But at the same time, it can actually be very rewarding. And we can find a lot of, you know, positive in terms of going through that negotiation. I think with support, right? Being able to talk about it. And I think as we see the ways in which our communities and our populations here in the States are shifting and changing, we'll have more of that dialogue. And I think we'll start to see more of that come to light.
In considering this difference between collectivism and individualism, and now focusing more on transgenerational trauma within these communities, I would imagine these are two very different ways of approaching trauma. You know, I'm thinking about this through the lens of clinical work of, are you doing individual therapy? You're doing family therapy? You're doing multi-generational family therapy? Like, what does it look like? Can we go into that a little bit more in unpacking these cultural differences and how that relates to the experience of trauma?
Yeah, absolutely. So I'm trying to think of where might be a good place to start. So I think it might be helpful to just talk about what intergenerational trauma is. So intergenerational trauma refers to the transmission or the passing on of trauma between generations. So it's when a traumatic experience of one person indirectly or directly impacts their descendants. And you know, we can think about examples such as from the children and grandchildren of survivors of ethnic genocide. We can also think about one of the most poignant examples here in the United States, which is the impact of slavery on the Black community, right, and continued racial trauma for the Black community. And what we see when we've looked at these groups is that descendants, right, of those who had kind of firsthand experienced the trauma often describe things like feeling uneasy, anxiety, fear, in spite of never having directly experienced a traumatic event themselves. And in a lot of cases, traumatic experiences weren't necessarily shared with the descendants, right? They weren't exactly talked about or shared or kind of openly passed on. But there's just something, right? People identify there's just a different way that I'm seeing the world, that I've been kind of taught to engage with the world. And so we can think about these experiences in the context of history, right? So when folks begin to explore the lives of their ancestors, they might start to understand their own struggles. So some of the things that they're maybe having a challenging time with. Now, intergenerational trauma can look like indirect communication patterns, secrets and silence, maybe negative worldviews, or We may see efforts to anticipate disaster, operating in survival mode. Even this lack of a sense of belonging can be indicative of intergenerational trauma. Things like guilt can also be an indication of intergenerational trauma. And so we just start to see patterns of behavior, experiences that may not necessarily directly relate to a specific experience someone has had, but upon further inspection and understanding kind of the context of their family history, their ancestor history, we start to see maybe why those things have developed. And when we think about the AA and NHPI communities in particular, there have been a lot of difficult events. Massive immigrations, wars, natural disasters, major conflicts. And when we actually look at dates and years and when these things happen, we realize that we're actually not far removed from events like the Vietnam War, the Korean War, right? The Cultural Revolution, European colonization, right? Internment camps. And so a lot of us are not far removed from a parent, a relative, a family member who may have directly experienced trauma. And there's a lot of intergenerational trauma in our histories, right, within this kind of umbrella community that we have, that our ancestors have survived, that we may still be feeling or impacted by. And we can even just sort of think about more recent events post that kind of larger immigration period I was referencing earlier, sort of in the 60s and 70s, right? So we can think about even just a few years ago, anti-Asian hate. We can think about the trauma that occurred after 9/11 for many of our brown Asian communities. And we can even just think about just generally the immigration process for our parents or grandparents, right? That process alone might contain experiences of trauma, certainly many adverse life experiences, right? That can then be sort of passed on intergenerationally. And we can also think about individual trauma as being disruptive generationally too. So it doesn't necessarily have to be something that a large group of us has maybe dealt with, experienced, or been exposed to, but even individual trauma can be, like I said, disruptive at a generational level.
When we're looking at your standard Western psychotherapeutic models, these were generally created by and tested on particular groups of people. As one of our former presenters said, the Times New Roman font. The white, probably affluent college student is really what comes to mind when you think a lot of these research studies. But so let's start with that kind of first question about how do we talk about this in communities that may not want to talk about this because of everything they've been through. But then also, where do all of these quote unquote evidence-based practices fit in as kind of part two of that question?
Yeah, absolutely. So there are a lot of things that may limit someone's willingness to open up about trauma. So generally and universally speaking, and kind of just taking my own anecdotal clinical experience, it's just really hard to talk about a traumatic experience. And what we often see is that there's a tendency towards avoidance. And this makes a lot of sense, right? The goal, right, of the brain and the body after going through trauma is to ensure survival. So the brain doesn't want to allow folks who have experienced trauma to reconnect with that, right? It's too overwhelming. It's too emotional. It's too scary. We don't want to go back to that memory, that feeling, right? So that is one thing that can really impact someone's willingness to kind of talk about trauma, even just their agency, right? So it's not a reflection of someone not having ability, right? It's just a reflection of the way that the brain is trying to ensure survival. So that's one thing, right? It's just generally hard for people to open up about these experiences. Often it takes time and distance away from the event to kind of really finally feel like, okay, I can maybe start to broach this or talk about it. And that's also also what's important to recognize is that that memory never goes away, right? It's there. And for individuals who ultimately kind of develop PTSD in response to a traumatic experience, that can be a really distressing experience, like just having that memory constantly there, right? So an individual might be just struggling to kind of continuously push that away. They may feel fearful of stepping back into the memory and reconnecting with those really scary, awful emotions. And that can kind of like create silence, right, around the experience. And so then they may never talk about it with their family, with their kids, their loved ones, right? They may never share that, but they are still impacted by the experience. So their behaviors may be shaped by the trauma. How they view the world, how they view themselves, how they view others will be shaped by that experience, right? And so those are things that then sort of get passed on. Now, when we think too just about AA and NHPI communities, I'm going to take us back to some of those common values that we might share across different cultures. We think about collectivism, right? I don't want to bring my stuff up. I just want to like maintain emotional self-control, which is another value we see commonly, right? So those are things that may reinforce just not talking about things, right? I just want to keep the peace. I don't want to be the person that stands out. We also think about avoidance of family shame. I don't want to talk about this and have others know. That might bring shame on my family. And so those are things that might lead one to just sort of zip it up, right? And not talk about it, not share it. And we might also just do this as a way of wanting to protect others, right? I don't want my kids to know these things, right? I just want them to focus on being successful in their life, right? I made it this far. I want to make sure that they kind of continue forward, right? I don't want to put this on them. And so there are a lot of different things that can reinforce this behavior of just not talking about the trauma. What's important to remember, though, as I said, is that it will still shape our worldview, how we see the world, how we engage, how we interact, what lessons we pass on to our kids, right? What we tell them about the world. So it's still actively kind of playing a role, right? Even for as much as we may just sort of put it in a box and put that box on the shelf. So when we think about working with AA and NHPI clients, groups, communities, this is where it can be challenging, right? And let's also not forget just the general stigma of mental health, right? Which we see everywhere. That's not unique to AA and NHPI communities, right? But that's another layer that can get sort of cemented onto this tendency to maybe not open up or share or talk about things, right? So what we want to be mindful of is one, what might be getting in the way of a client, a group, a community opening up and sharing, being respectful of those things, right? And then kind of what are the therapy skills that I have to sort of help someone? My favorite therapy skills are the foundational basic skills that I learned in my first semester of graduate school: listening, reflection, working on building rapport. So we cannot underestimate the power of those tools, right? We can easily kind of get caught up in the manuals, the techniques, the strategies, the advanced therapies we all sort of step into, but we never want to forget those foundational tools, right? Because that's really going to set the foundation for creating a space where someone may feel trusting, willing to open up, safe, or willing to just be brave and courageous and sort of talk about something they've held inside. So I like to encourage folks that I work with, even the trainees that I work with, and sort of learning the psychotherapy process, to never underestimate the power of reflection, active listening, building trust and rapport with our clients, because that will carry us through and take us a very long way, especially when it comes to working through trauma. An example that I share with a lot of folks is I remember a young woman that I was working with came in, had a number of symptoms that I felt like there's got to be something missing here. Everything she's telling me, I'm not sure what is the cause, the origin, what's going on here. Continued to kind of work with her. She was really reluctant to engage in therapy, but she kept coming back. And so for me, it was like, okay, I'm going to just trust her guidance here, right? I'm going to do what I can, but I'm going to allow her to kind of guide me to it. A year later, she opens up about trauma and a significant trauma that occurred for her, right? So it took a full year for her to even bring that into the space, right? To even mention it. And then a little bit more time even for her to kind of really delve into it. So we want to be mindful of that, right? That trauma in and of itself, hard to talk about. Let's layer on shame, stigma, some of the values we might see in AA and NHPI communities, which may reinforce some of that, like zipping it up, putting it away, not talking about it, right? And then we want to think about, okay, do my Western approaches, the manuals I have, the treatments that I've been trained in, do they fit here, right? Sometimes they might, sometimes they won't. And so what do we do if they don't, right? How do I still continue to support someone who might be dealing with trauma, intergenerational trauma, trying to unpack family histories, right? So on and so forth. So the other thing that I really encourage folks to do is take a strengths-based approach, right? Remembering that there's no one-size-fits-all answer here. What works for one client may not work for another and vice versa. And when I talk about strengths-based approaches, I think about what is within my client already? What's the wisdom that they already have? The values, the cultural practices, the things that they might already have within them that I can help them kind of build awareness of, connect to, bring to light, right? Reinforce as a healing practice. So when we look at the diversity within our AA and NHPI communities, there are, just an incredible amount of healing practices, things that don't fit within our traditional Western version of mental health, right? And just because we don't see them in that system, it doesn't mean they're not important, valuable, important to preserve, right? So I might just start with a question of, well, what have been the ways of healing in your family? What did you see your parents do, your grandparents, cousins, aunts, uncles? Pointing them and directing them to things like art, prayer, even food, right? Many of the rituals we have around food contain healing elements to them. So encouraging folks to connect with those sources, right? Things that I may pass on as like, yeah, this is just what my mom does every Sunday afternoon, right? But if I take a step back and say, wait a second, what exactly is this ritual for her? What does it mean? Where did it come from, right? I might start to uncover a lot of ancestral wisdom and value. And that might actually be really healing for me. We have to kind of remember that, within this large umbrella community, right? Many of the cultures that are contained within that, their concept of well-being has always contained a very holistic lens. And we can easily lose that. Growing up here in America, I've experienced this, right? We can easily kind of move away from things that are part of our heritage, our culture, especially when we have these Western ways of being imposed on us day in and day out. We might abandon ourselves, our beliefs. We might do this just to survive, adapt, fit in, right? To be that model citizen. But our cultures have had ways of healing that are thousands of years old, right? Western science is finally catching up to this, appropriating it in some regards, right? But even just thinking about, simple acts of breathing, right? We have books that tell us that there are different ways to breathe that can be healing, right? There are cultural healings. There are movements that we engage in, right? That can be healing. I often think about the folk dances that I learned when I was young. And when I think about that experience, it brings just a sense of like joy and freedom. And like, underneath that is like, there's some healing there, right? Like I was connected with my community in that space. I was doing something that felt really good physically for me. The music that was playing. So there are things, ways that we've moved in our cultures, right? That can provide some of that. Art, right? Coming back to our collectivistic practices, right? Connection. And we know that when we think about resilience and working through trauma, connection, right? Having support from our loved ones often leads individuals who go through adverse life experiences, trauma, towards resilience, right? Having guidance and support. So these are things that we may sometimes see as challenges, but we have to sort of identify the other side to that, right? In what ways are these healing for us? So you may even encourage clients, and you yourself as a provider may consider, okay, well, what are other spaces, paths that I can encourage someone to take, which may lead them to mentorship, right? Mentorship, I think, is not something we talk about often enough, but it's an incredibly valuable space and can also have a lot of therapeutic qualities. And I like to talk about mentorship, especially in our day and age when therapy is so inaccessible to so many people. Mentorship is often free, and it comes from, the elders in our community. It comes from, maybe religious figures we hold in high esteem. It comes from, the folks who hold the wisdom. And so we can think about those relationships, right, as therapeutic. Just the act of connecting with people that look like us, hold identities similar to us, share experiences we have, can also be healing too. So what can I encourage my client to engage in that puts them in a communal setting that might feel better for them, that might allow them to process their experience, share their experience, connect with others who have their experience, right? Those are all things, processes that we try to create in the therapy session, but can also be very much accessed in these other spaces. The other thing that I want to talk about too is just stories. So when we think about the way that things are passed on generationally within the diversity of cultures that exist in this umbrella group, stories and narratives are incredibly important, right? They give voice to our experience. They pass on lessons, right? They allow us to stay connected to our ancestors. And when we can share our stories, say the hard stuff, right? We learn about ourselves. We put context to what we're experiencing on a day-to-day basis. Sometimes makes more sense. And that's another starting point in terms of healing. So I like to encourage my clients to step into their own narratives, to just practice talking about themselves, sharing things, right? Even just asking questions of their loved ones, and sort of honoring that as a preservation of culture, right? These are things you can carry with you, right? These are things that have, we've seen historically, right? Since the beginning of time, just the passing on of stories. And so that's another technique and healing element that I think can help us when those Western practices aren't fitting or aren't really hitting the mark, when we're working with folks who are just diverse in terms of their identity in comparison to us, maybe different from us. And so again, not things that are necessarily what we would consider gold standard in treatments, EBPs, right? EBTs, evidence-based, but we can't also deny thousands of years of practices, right? There's value there. So we have to encourage folks to consider that, right? And we as providers can find ways to lead our clients towards that.
I love the question that you had mentioned of what have been the ways of healing within your family. I think that is so powerful, and also acknowledging that every single family has its own culture. Going back to intergenerational trauma, as you mentioned, a lot of these things are relatively recent. That we need not look back 1,000 years. We need to look back within 100 and say, oh, look what happened here. Where does family therapy fit in? Again, that straddling of collectivistic and individualistic culture. Do you find yourself often recommending that an individual bring in family members? I'm just curious.
Yeah, I've certainly encouraged folks to bring in family members, even if only to just have a space to give them some psychoeducation, right? Help them understand what their loved one is experiencing. I think it can be incredibly helpful to involve and keep folks that you trust and love in your process of therapy. It can also absolutely be a completely private thing that you just do individually, right? So it's when you feel ready. But I certainly encourage my clients to think about, well, what would it be like if your loved one knew about this experience? How would it feel to share that, right? Kind of exploring that with them. And then sort of just planting seeds, right? Of this may be really helpful for them to know, to understand, right? How can you bring your parents into the mix here, right? What would you want to share with them? And certainly, this isn't a linear path by any means, right? There may be some things to work out, barriers that we may experience to creating and strengthening that family relationship, but absolutely bringing folks that your clients trust and love into the therapy space can be incredibly helpful, right? I like to talk a lot about modeling. I think modeling is so powerful. And if let's say I go to therapy, I pick up some techniques and I start to implement them in my day-to-day life, there's people watching me, right? My niece and nephew are watching me. Even though they might not be saying anything, they're picking up on the way I'm talking about things, the things I do in my day-to-day life, right? Our family is kind of watching us, right? And so we can model things that we've learned as another way of bringing folks into that therapeutic space and that therapeutic process, right? So we never want to underestimate what we're doing and who might be watching us. I mean, even if it's a coworker, right? An acquaintance, a friend, right? The things that we do are being absorbed and perceived by everyone around us. And so we can absolutely kind of, what's the word I'm looking for? Encourage, facilitate, plant seeds, right? For others by taking what we get out of a therapy session experience, right? Healing process, and just continuing to put that forth in our life. So there are a lot of ways, right? Direct and indirect, to bring family, loved ones into this space.
I love that example. I think that's a really neat way to frame it, in that someone need not necessarily be in that room in order for it to change the way that a family operates. As you've been talking, there have been some little keywords that have jumped out at me in talking about this idea of intergenerational trauma, ideas around storytelling. My brain went to narrative. Are there some of these more mainstream Western models that you feel like can bridge some of that gap to better serve AA and NHPI clients, like narrative therapy? I was thinking about, old school, but I was thinking about genograms.
Mm-hmm.
What are some of the things that you reach for? Because I think in the alphabet soup that is Western mental health care, I think this is where Western clinicians might get a little bit lost, where it's like, well, okay, so I work on rapport, and I work on my mirroring, and I ask these open-ended questions, and then what?
Yeah, absolutely. A lot of our tools are going to be supportive of building narrative, right? Essentially, right, at the end of your work with someone, they're going to walk away with a story, right? And the things that we're doing, the cognitive restructuring we might be engaging in, the journaling practices we might be encouraging, narrative therapy, right? Those are all things that are helping your client build their story. I'm heavily trained in, cognitive behavioral techniques and practices and therapies, and that really very much forms a good foundation of my practice as a professional. But there's more to CBT practices than just kind of this very sterile, straightforward, thought, emotion, behavior, right? When we help someone restructure cognition, we're also allowing them to reframe thoughts to be more positive, but they may also be just reframing their story, right? They may be taking that skill of reframing and starting to apply it to their family experiences. So I'll use myself as an example again. When I was younger, I really resisted a lot of the things that my parents tried to implement for me in my life. I didn't want anything to do with it. I didn't want to be associated with any of those cultural things. I was like, annoyed by it. Like, why do I have to go to this every Sunday? All of those things that, an angsty teenager went through. As I got older, went through my own therapy process and was able to build this practice of kind of stepping away from that, I started to be able to reframe their experience within their history, right? I wouldn't have been able to do that had I not learned those skills or just been able to kind of practice this act of stepping outside of myself, right? And those are things that I think are very common within a lot of our Western therapy practices, right? A lot of what we're trying to assist our clients with is sort of taking a step back and coming towards a balanced picture of where they are, their worldview, what they're doing, feeling, experiencing. Things like journaling, right? Just an incredibly simple, research-backed way of leading someone towards resolution, clarity, right? Those are all things that I think are incredibly helpful. Just even processing emotion, right? If I can help someone learn strategies around processing emotion, they're going to experience some of these more challenging family experiences, community experiences in a more effective way, right? They may be able to say, hey, wait a second, where is this emotion coming from? What's going on in this environment, this scenario? What's it triggering for me? What might it be coming from for the other people involved, right? So there's a lot of value in terms of the things that we have already. Even just, I think a lot about self-compassion. That can be incredibly hard for us as AA NHPI identified individuals to experience when we think especially about some of our common values. Learning to just be compassionate towards ourselves, to work through feelings of guilt, right? Things that may have been passed on to us, or sort of ways that our behavior may have been shaped, right? From a cultural context or historical context. That practice of self-compassion can be incredibly powerful, right? If I can just be a little kinder to myself, I end up going into and dealing with the situation just in more balanced. And even just exploring, encouraging kind of that, I think about sort of DBT practices of like, it can be this and this at the same time, right? Like even just validating and normalizing that, yeah, you can hold this emotion and this emotion, even though they seem opposing, right? They can both be present in this space. So even that can kind of take the pressure off of someone, give them some relief, right? Just normalize and validate their experience. So those are all things that I certainly continue to pull from and pull into my practice, when I am working with folks on things like intergenerational trauma, race, identity,
In Western mental health care, in the systems that we have, there are often limitations on time. You can have this many sessions in this period of time. Your sessions can be this long, or else there's going to be an audit. This is what our contract gives you for clinicians. This can often put clinicians into like a position of pressure. I need to talk about the thing. I know I have seen that. I've seen that real time. I have been on the phone with insurance care advocates, and they say, well, have you started talking about this trauma? Like it needs to come up before this person leaves treatment. And there's this pressure to rush. One of the things that I've heard as you've been speaking about this is kind of the importance of pace and developing trust. How do you work within that framework when it is kind of, I guess, counter to the system, when the system is saying, go quickly, we don't want to pay very much. And it's also like, well, you have, someone's coming in and saying, I have symptoms of insomnia. I've been having stomach pain, like somaticization. They want relief of symptoms and kind of that maybe internal battle that clinicians are feeling of like, how do I address all of these things when there are different timelines coming up?
That is incredibly hard. And it's something that I've struggled with too when I'm working with folks where, let's say, I only have 6 sessions. And I'm like, how am I going to do all of this? Right. What I try to do is be direct in a compassionate way. Once I have an idea or a strong hypothesis about what's going on. But again, it's so hard with trauma because folks may not be ready to go back to that memory and process it and put it away and, resolve and work through that. And that is okay. We don't want to rush anyone towards that. What I might do is just identify what are the most poignant things. What is the thing that's getting in the way of this person's day to day? And we might just start there. And I'm a big advocate for education. So I will try and give as much of my knowledge to someone as I can in the time that I have with them, so that if that seed that I've planted blooms in 2 years, they can say, oh, wait a second, I learned something about this, right? But also to normalize just why they might be experiencing the things that they are. And sometimes that can be incredibly healing, right? So I have certainly worked with folks where we haven't really delved into the exact trauma. We haven't talked about the details. All we've maybe focused on is symptom management, psychoeducation. How can I get them to a quality of life that feels okay for them? It doesn't have to be their ultimate end goal, but can I move them towards that even just a few degrees? Can I make their day-to-day even slightly easier? Some of that might just come from helping them understand why their brain and body is responding in the way that it is, and then kind of giving them strategies and tools to manage that. This is where I often encourage folks, really, if you can, bring your loved ones into this, right? They're the ones that see you every day, right? If they can understand what's going on for you, they can support this process, right? It doesn't just have to be you in therapy working with me, but even after the fact, when we've said our goodbyes, right? If your parent, partner, spouse, whoever, right, is within your home space, knows why you may be feeling anxious in response to a certain thing, right, then they can help support you through that. So there are a lot of things that we can do in that limited amount of time. I try not to succumb to that pressure of, I've got to get everything, but kind of come back to what seeds can I plant? What can I do to improve their functioning, even just a few degrees? And what can I allow them to take out of therapy and carry with them? Resources, knowledge, other therapeutic avenues, right? So thinking about what's within your community, what is healing, right? Expanding their definition of healing. And I think that can carry folks beyond what limited time we may have with them.
Mm-hmm. Thank you. Thank you for covering that, because I think it's a sensation a lot of clinicians can relate with, of just this kind of pressure. I have to do it all now.
Mm-hmm.
And I appreciate what you're saying of, what happens if we step back and look at functional capacity and how do we improve that just a couple of notches in order to help somebody feel better, which is foundationally what our priority is. For people who are listening that want to learn more about some of the things that we've talked about, are there any particular websites or periodicals or books that you really recommend?
I'm a big fan of qualitative information. I think that influences my work more than a lot of the stats or quantitative research articles that come out there. Not to say that those don't have value. They absolutely do. But I think there's a lot that we can gain from just someone's full contextual experience. So there are a few books that I've come across more recently that I really have enjoyed. So one is What My Bones Know, a memoir of healing from complex trauma. And the author's last name is Foo, F-O-O. And the other one is They Called Us Exceptional and Other Lies That Raised Us. The author's last name is Gupta, G-U-P-T-A. That book, both of those books came out last year, I believe. And I also recently came across a really interesting podcast on NPR called Inheriting. I believe it was just released, but one of our wonderful members from the Asian American Psychological Association, Dr. Sherry Wang, shared it with our community. And I believe she's been a part of it, which anything that she's a part of is really great. But it's a podcast that talks about some of these very things we've touched on today: intergenerational trauma, our experience of our family histories, things that we, take on from our ancestors. And it looks to be a very interesting series. So I'm looking forward to kind of listening to those episodes as they come out.
Fantastic. Thank you. Those are wonderful resources. And for listeners who want to learn more specifically about you and about your work, what's the best way to do that?
Yeah, so I often refer folks to my website. It's dranjuliamin.com, all one word. And that has a little bit about me on there. I am not a social media person, so I don't have like a handle on Instagram or anything like that. It's just been part of my practice. So you won't find me in any of those spaces, although I've considered coming back to it. But my website is like a great place to learn a little bit more about me, about my practice. I always encourage folks to also check out Asian American Psychological Association. There's a little bit about me on there, just because I'm still a part of the executive committee, but if you want to learn more about me and my practice and how I sort of grew up in the field of AA and NHPI psychology, there's a lot of history there that was influential for me and I think is really cool to peruse. And a lot of really great resources just on mental health generally for our large umbrella community.
Wonderful. Thank you. This has been eye-opening and powerful. I sincerely appreciate you taking the time. Again, for our listeners, Dr. Anjuli Amin, this has been very interesting, and I will most certainly check out the resources that you've recommended. Thank you so much for joining us, Dr. Amin.
Absolutely. Thank you so much for having me.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need continuing ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of continuing ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.